Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We're helping infection preventionists and other healthcare professionals who are on the front lines battling COVID-19. My guest today has certainly been on the front lines. Jody Feigel is the nurse manager in charge of infection prevention at the VA Pittsburgh Healthcare System. Ms. Feigel's background includes infection prevention, of course, but also nurse management, cardiothoracic surgery, and medical device sales education. She and a co-author, Dr. Brooke Decker, Dr. Decker happens to be a member of our editorial advisory board, by the way, are writing an article for Infection Control Today about the place of telemedicine in infection prevention. Ms. Feigel, thanks for joining us today.
Thank you for having me. Nice to be here.
People, this layman included, don't usually think of infection prevention as being one of those things that you can do with telemedicine. Did the COVID-19 pandemic change perceptions in general? Did it change your perception in particular?
Actually, no. I've been very blessed with a very smart group of 6 infection preventionists, all master's prepared nurses. And while they are on call, they do have their laptops at home and are required to take calls from all throughout the hospital and then look up patient information and report it, throughout either the CDC or PA NEDS. So we already had that back training in place.
Right.
Moving towards an office at home was just took a little bit of getting used to, but not so bad.
Are you speaking from your office at home right now?
No, I'm actually at the hospital today.
Oh, okay.
So,
well,
yeah.
I'm at home, if you can tell, right?
Yeah.
What was the major adjustment that you had to make?
I think just restricting our hours, because you find, when you're at home, you roll out of bed, you get your coffee, immediately get on your computer and you just work. When we're at the hospital, we have a lot of interruptions, and a lot of times they're good interruptions, sometimes not so much. And we head out to see whatever fires need to be put out. Still, we are continuing with education with the nurses, answering questions for anybody from housekeeping to maintenance, nursing, anything that we can do to help provide a level of comfort and safety for our staff is pretty much what we do in the hospital. At home, we're doing all computer work, and if you're on call, we're also answering the call phone.
You are the author of an article that we're running in our September issue of a very good article about telemedicine. I think you mentioned in the article that there are maybe some drawbacks. Sometimes the face-to-face, in some instances, in some ways, you can't replace that. Is that an accurate paraphrase?
Oh, for sure. It being at the hospital and having those face-to-face conversations and providing that face-to-face education is paramount in what we do. So, if somebody is needed to talk to a patient, talk to nursing staff, having those conversations, in front of somebody makes it a lot easier than just having a simple phone conversation. People get very distracted over the phone. And email just doesn't carry the same weight. So we do still like to have those face-to-face interactions. Yes, sir.
What was the demographic of of the VA healthcare system there? I'm assuming, and tell me if I'm wrong, that it'd be older people, veterans, or
All veterans, yes, sir. All veterans. We have 2 campuses. We have a campus in Oakland, and then we have like a skilled nursing campus over in Aspinwall, our Hines campus. So yes, but all of our patients are veterans. So we're very blessed to be able to take care of that patient population for sure.
And also, you wouldn't call yourself a nursing home, but it is an older population, so that has been, wasn't that the nexus of COVID-19? That was a problem?
No, not necessarily. We have vets that are in their 20s that come here for care. And then we also have vets that are, World War II vets, World War I vets that come to the VA for care. So yeah, depending on the patient's needs, we care for veterans of all age, all socioeconomic groups. Any vet can come to the VA for care for sure.
What were main questions? What were some of the questions you were getting from fellow staff members when COVID first hit?
You know, people were very afraid. They had questions about the guidelines, and I can tell you when COVID first started, the guidelines changed. It seemed like hourly. Sometimes it was daily. So providing that education on, you know, what PPE they needed to wear, how we were going to isolate patients, you know, how the organism was transmitted. All of those were huge concerns for staff because, you know, they're watching the news and, you know, comparing the VA to, you know, a lot of other facilities. So we had to make sure that, you know, we emphasize the importance of CDC guidelines and and that's really, those are our, you know, that's who we're going to follow when we're caring for our patients and is protecting each other.
I'm going to ask you two questions, sort of like a yin and yang question. Was there a moment when you said to yourself, I wish I wasn't doing this via telemedicine? And was there a moment when you said to yourself, thank goodness I have telemedicine so I can do this? Were there those moments?
No, I love being at the hospital, but telemedicine, it does serve a purpose as well. When this all started, we decided very early in the process that with 6 infection preventionists, and they share office space, that we needed to make sure everybody was safe. So we decided to rotate 3 people in and 3 people out. So every day of the week, I have 3 infection preventionists here at the hospital, and then I also have 3 that are working from home. So it's a nice balance. Everybody gets a little taste of everything. And then Dr. Decker and I also, administration is asked and leadership is asked that we also consider teleworking, and we do that as well.
So how many people did you have under you? It sounded like you had about 6 infection preventionists under you.
I have 6 infection preventionists. Yes, I have 6 infection preventionists, and then I also have an administrative assistant, a PSA.
Now, would environmental services come to you for advice?
Oh yeah, yeah. Environmental services, because they don't have the level of training that nursing does. They had a lot of questions and a lot of concerns about taking the organisms home to their loved ones. And, you know, we really provide a lot of reassurance that if you're wearing your PPE correctly, if you're washing your hands, if you're practicing social distancing, of course, you know, greater than 6 feet, then you're protecting yourself and you're protecting other people.
Have you noticed waves there where you're at? I mean, did it peak at one point, go down, and all of a sudden peak again, and go down? Seems like that's happening.
It has happened, and I think it's happening everywhere. We've been fortunate that we got, our first wave was in April. Then it kind of quieted down, and we noticed peaks and valleys after probably 7 to 10 days after each holiday. So Mother's Day was Easter was our first holiday. It was kind of quiet. Then after Easter hit, the week later, we saw a little spike. Then we were hit with Mother's Day, or Mother's Day came. Then we saw a little spike. Memorial Day, Father's Day, 4th of July really ramped us back up. Also with the shutdown, that helped decrease our numbers, but we plateaued and saw a small decrease. But then after the 4th of July, we've seen an increase throughout the state as well as here in Pittsburgh.
When things get back to normal, notice I'm saying optimistically, you know, when things get back to normal, how they were before COVID arrived in our lives, do you see yourself using telemedicine more often than you did in the past? You just said that you love being on the ground, you love being at the hospital itself, but
Yeah.
Can you see yourself integrating it more in your practice?
I think we probably will continue to use it. It's, you know, I can't think of a downside of it except for being face to face with people. And I don't know what our new normal is going to be or when it's going to happen. It seems, I don't know that we're going to have a normal until we have a vaccine. So right now, this is our normal. And we're comfortable with what we're doing. We still feel like, you know, we're providing the highest level of care because we do have such trained and skilled people at the facility. I feel, yeah, like after things quiet down or, you know, whatever our new normal is after a vaccine, I think we still will be utilizing telemedicine I think there will still be a place for it for sure.
Jody Feigel, thank you so much for joining us here at Infection Control Today.
Oh my gosh, thank you so much for calling and having me. I appreciate it.
Now stay safe.
Thank you, sir. You too.